All right, welcome, welcome, welcome. Here it is, Coach Hamilton with the Coaches Code, coming back to you. Glad to be with you here another evening, beautiful evening here in the Shreveport Bossier area. Depending on where you are located, happy to be back here and excited about our guest tonight. This one probably give me a little more buzz behind this one because she is a doctor. She's a doctor and sports psychologist and have a lot of other things. I'm not gonna mess up and say all the wrong things. I'm gonna allow her to introduce herself and share all of the great things that she's accomplished and the things that she's working on and what she's gonna bring to the table to the Coaches Code Clinic. So you can see the flyer there. This is the inaugural Coaches Code coaching clinic. Empowering Coaches, Enriching Lives is going to be March 29th, 2025 from 9 to 3 at the beautiful Centenary Gold Dome here in Shreveport, Louisiana. As you can see, featured on there are two books that I've written called The Complete Coach, Integrating Wellbeing and Success in Programs, and also a workbook that goes along with it. And the Coaches Code is a framework that I developed over the last 20 years of my coaching career that is the ground basis for this clinic. So it's not for any one set of coaches in one sport. It's for all coaches in all team sports at every level: elementary, middle school, high school, college, whatever level that you're on. I've had the privilege of working on all levels in the last 20 years. And I'm very, very excited about this project that's out now, and also having the clinic to introduce this. So don't get it twisted. It's not just for basketball coaches or football coaches. It's for everybody, and you can see the registration link there as well. And like I said, very, very, very excited about the show tonight. Let me tell you a little bit about what I have here, the framework that it was birthed out of. The Coaches Code framework. COD is an acronym, and the letter C is for Coach with Purpose. The letter O is Optimize Team Dynamics. The letter D is Drive Success Through Well-Being, and the letter E is Empower Through Modeling. So my career over the last 2 decades, these are the lessons that I've learned. I had a epiphany probably about 10 or 11 years ago in my life, where, like I said, this is not about me, but just telling a story where I was struggling with coaching. I was struggling as a minister. I was struggling as a musician, struggling as a husband, as a new father. Life was tough, and I had to go through some trials, and this birthed out of that. And it helps to keep me grounded in my purpose for why I coach and how I coach. And so definitely want to get this out and share to the coaching public in this platform. And here today, I have another special guest with us. This is Dr. Jessica Davis. Very, very excited about the owner of Legendary Minds. Like I said, I'm not going to do the disservice or dishonor of forgetting all of her accolades. But here is a write-up here of some of the things that she's in. We're excited about having her. She is from here, Shreveport, Louisiana, a proud graduate of C.O.D.E. High School, a longtime rival, but we're all on the same team now, so that's cool. So we're going to jump right in, and we're going to invite her in, and we want to welcome Dr. Got to make sure I get that right. Dr. Jessica Davis. Come on in, Doc.
Hey, how you doing?
Doing fine. How are you doing today?
I'm doing very well, no complaints at all.
Yeah, that is wonderful. It's wonderful. This after a long day of work, coming in here and got to talk to this old man tonight.
I'm actually excited for the conversation we're gonna have. So,
Yeah, definitely looking forward to this. I know that there's going to be a lot of great information to share, and we're just going to have fun tonight. We're going to have fun tonight. And what I'm going to do is right now is just give us an opportunity to get to know you. You have a diverse background. Like, man,
yes.
you have seen a lot at such a young, tender age. What I want to do is I want to hear a little bit about, before you go into what you do now,
Okay.
I want to know, of course, let us know, your background. I know you were at Bird High School. You did play basketball, correct?
Yes, sir.
Okay. Now
I
that,
only played my freshman and sophomore year. I also participated in track, and then in college, I did a lot of intramural sports as well as like flag football for Southern. So,
that's cool. That's cool. You sound like me. I went to college to play ball, and I got hurt, and I wound up being an intramural baby. So
um, I
had a lot
am.
of fun.
I'm
Yeah.
five. I'm 3, so my dad gave me that harsh talk, like, "Hey, the likelihood of you advancing is highly unlikely, so you might want to focus on academics." So I did.
Thank God for fathers.
All right, right.
Yeah. So yeah, tell us. So tell us after leaving high school. Okay. You went on to college. So tell us, how did you transition or making the decision you're going to go from criminal justice to going
Mhm.
into nursing and then now into mental health? Take us on that journey with you.
Oh wow. So going into college, I always knew I wanted to do something where I could help other people and be an asset to them. So initially I wanted to take that lawyer route. And so after interning and doing things in that field, I realized like this isn't really my lane. I'm not enjoying it as much as I thought I would. And
Okay.
so nursing had always been something that was a highly respected service. They got to help people and see things, from a different perspective. People at their worst, helping them get to their best, or however that was. During clinicals, I realized like I wasn't truly committed to the bedside as much as other people were. And I think if you're serving in a capacity, you want to put yourself in a space where you're a match as well. So
Okay.
during my psych rotation, I just it was something that most people didn't enjoy, but I did. And so I realized that I was in the right place at that time. And so I realized the importance of mental health very early on, the respect component, the perception that came with it, and the stigma. And I wanted to be a part of, changing that narrative and really destigmatizing mental health, but also being an asset in the space. So,
Mhm. So I guess my question is too is like, how is it that going into the mental health space, like, for context, if you don't mind, like,
mhm.
when did you graduate high school?
Sorry.
What year did you graduate high school?
Oh, 2012. I'm sorry.
Okay, 2012. Okay, so that was my first year at Fowl Park, my first year there. I finished high school in '98, and
Yeah.
so I was raised up in the '80s and '90s, and we didn't hear anything about mental health.
Right.
We just winged it best we can. I mean, just our parents did the best they could with what they knew, and then you coming into this era. So I'm pretty sure your parents, like I said, a little older, a little more seasoned. But how did you get introduced to that, where you saw that this was something that you would be in, like? Because, like I said, we don't hear that, especially in our communities. We don't
Right.
talk about mental health. So how did you gravitate, to that specifically?
So, honestly, growing up in a minority family, you hear stuff. You ain't crazy. You better go in there and sit down. Like it's like literally like that. And so,
Yeah.
I had relatives who battled different things like schizophrenia, and
Okay.
growing growing up, I would see that, and I'd be like, well, "What's wrong?" And of course, I knew that they were different, but I didn't know the depths of the differences. And so for me, just being a very curious kid in regards to what was going on all around me, I began to take interest. And so when I looked into my program for psychiatric nurse practitioner, there weren't a lot of programs at the time. But because I got into that space, I was able to talk to those patients like people. I was able to get responses out of them that other people weren't, even during my clinical. And
Gotcha.
I realized very early on, respect, it takes you a long way. If you treat a person like they're human, they'll treat you with that same respect. And so just with it being something I was good at, like I said, in clinical, I don't think it was something that initially I really knew too much about. But I think when a space is for you and you see where you could create that impact or that avenue. And so for me, entering that space and kind of seeing like, wow, how can I work and operate with this particular population and actually spread awareness, you know what I'm
Right.
saying? And actually get people more comfortable in speaking on their mental health, their mental condition, their mental performance. I realized that that was something I wanted to take on.
Well, I like that. I like that. So you were very, very intentional with the things you paid attention to.
Hmm.
And like I said, you had somebody around you, you were able to ask questions. So I like the way that you were able to kind of pick up on your own awareness, the things that you were leaning towards, because I'm pretty sure that that's something you just walked around and saw all the
Right.
time, being
Right.
able to. So did you ask questions with your parents or, somebody at the college that you went to, like, you know, who introduced you to it, or like what was it that you was able to say, I want to go that direction? Like, was there a person you were able to talk to dig into that a little bit more to understand it, or did you just research it on your own?
I think between researching it on my own and actually, like I said, knowing with nursing, you could take so many avenues. So you can go case management, you could go ICU, you can go critical care. A lot of people aren't lined up to work psych, or they weren't at the time in which I started. And
Okay.
so, to me, mental health and psych is a form of ministry. So it's one of the
Yes.
only lanes where verbally I can de-escalate you. Like if your heart stopping, me just saying, "Hey, wake up," that's not that's not gonna do
Yeah.
anything for you.
Yeah.
But if you're truly going through a crisis and that right person is able to speak life into you, if a person is experiencing suicidal ideation, or if somebody's depressed, like you're able to kind of give them a word to uplift them, and it's not so medicine driven. Sometimes, it's truly holistic in how people perceive what you're saying. And so for me, being somebody that's more therapeutic, feeling like I have a gift in which I can de-escalate situations and help people see a different perspective, I felt like I said, I was truly operating in my purpose and utilizing my gifts. So it just organically worked out for me. But I didn't view mental health as like, oh, something's wrong with them. It's just
Yeah.
how can I help? You know?
Yeah, yeah, I like that because that does say a lot about you when, because like I said, it's very very easy, especially when we're kids, and you know, you remember that people joked, they just
Yeah,
did,
yeah,
and I want to be, we want to be politically correct, but at the same time, I want to be open here. We as kids, you heard stuff about special ed, and or
right,
they'll say stuff like retarded. We say those things, and it was out of ignorance. We didn't
right,
know any better, and we didn't know, but you had an inquisitive mind
right,
about it and
right.
wanted to understand it. And I think that right there, our pastor always teach us that we want to, with our children, find out what their natural bent is. What are
Mm-hmm.
you leaning towards, and
Right,
help you to ask the right questions in
right,
order to find out, and so for you now to have this career now, proud graduate of Bird High School, you came back home, you get a chance to have this expertise that we don't have a lot of representation. We have people that try to help out in the space, but
right,
not properly trained.
right.
And so, with you having the proper training, how does it feel for you to bring this back, home? And then also, now with me starting the Coaches Code Clinic and having a platform and an avenue for you to talk about this specifically to us as coaches who we deal with children all the time in the school system and athletics, man. Like, so how does that feel when we got a chance to have that conversation? What, kind of what frame of mind did you go into when we had the conversation initially?
So when you and I initially had the conversation, of course, I'm always excited when coaches are receptive to my vision and mental performance, mental conditioning, mental health as a whole. Like I said, for so long it's been stigmatized. It's like, oh, nothing wrong with him. He just lazy. He don't want to play. You know what I'm
Mm,
saying? Or coaches aren't always conscious of what they're experiencing. While they're coaching student athletes, they're not conscious or aware of what's going on internally with them or their
yeah,
student athletes.
yeah,
So, just to kind of have that conversation with you, and you have insight and awareness of it, and you're able to see the value in mental conditioning and the services in which I provide.
yeah.
It's always refreshing for me because it's like, hey, I have another opportunity to educate or help or impact a larger group of students or population. So it was exciting for me.
Yeah, it was the phone call was definitely different. You know what I'm
Yeah.
saying? Like it was different, but at the same time refreshing. This was my first year out in Plaindale. It's a long ways away. Didn't have a whole lot. Just financial and things like that. But it's definitely something that we are going to work together on. I definitely want to be an advocate for that in this space. And this is the perfect opportunity to make a presentation in front of
Yeah.
coaches, hopefully athletic directors. So, man, definitely looking forward to what you have to bring to the table. So we'll just go ahead and transition a little bit here. So
Okay.
you're going to be a part of a panel, okay?
Okay.
Overall panel is going to be overcoming modern coaching challenges.
Okay.
But you specifically, one of the things I want addressed is, like I said, the mental toll of the coaching profession. Because
Okay.
if we're going to help student athletes who have these issues, we got stuff we got to work on too.
Right.
And so, and I'm saying it out of experience. So for me, back in 2012, 2013, my wife and I were going through some things. My son was getting ready to be born. And when I tell you, I pretty much lost it.
Right.
But I went to therapy, went to counseling, and I still go to therapy to this day.
Right.
It's something that I enjoy. It's not one of those things I look at as like, no, I enjoy it, you know.
Mhm.
But at the same time, even with receiving that type of help, I'm still human. I still
Right.
make mistakes. I still make bad decisions, but I'm more self-aware now.
Right.
And part of that too, you said about ministry. I'm a minister. And so, I go to a church that does a good job in making, scripture more practical on day-to-day living.
Right.
So I noticed a direct correlation between when I'm better, we perform better.
Right.
When I'm struggling, we struggle.
Right.
And so, with that, what role do you think that mental health plays in a coach's ability to lead effectively?
So I would say you mentioned one of the key words, just the humanistic aspect, just being human. Coaches oftentimes they're so busy pouring into others that they don't recharge themselves. You know what I'm saying? They're stressed, they're not dealing with the stress management. A lot of coaches do have families, they do have other obligation, and they're consistently pouring from an empty cup. And so I feel like at some point you no longer have anywhere to pull from. And so, unless you're recharging, unless you're able to take a step back and have that healthy balance, rest, recover, recuperate, you're not going to be able to bring your best self to the stage to even give that level of insight. So,
Yeah,
if you're not recharging, you're not recovering, you're not giving yourself that mental rest that you would need. It's kind of hard to just keep showing up 100% because you don't have 100% to give. And ultimately, that spills off into your leadership, what you're able to provide for your students, and then ultimately yourself. And then your
yeah,
body has a way of dealing with that as well.
yeah,
So, if you're not showing up as your best self, how can you give your best self? And so
yeah,
I just think a lot of times when coaches are coaching students, they're not taking a lot of their advice firsthand. So if I'm telling you,
ah,
if I'm telling you, as a provider or whatever, you should eat this way, or you should do this, and you should do that, and then I'm eating the polar opposite way, I am able to give you that information, but I'm not practicing that. And so
yeah,
whereas it might be fruitful and working for you, I'm not utilizing my own knowledge. So
right. Well, that goes to the letter E in the coach's code: empower through modeling.
yeah.
Let's say, look, like I said, we're human,
Right.
and we have a lot of stuff going on, and that's one of the things that for me, with the message that we hope to get across, that we will, I ain't gonna say we hope to, that we will get across, is understanding that your job is your job. It's
Right.
not your life.
Right.
Uh, I made some decisions with my career that some people didn't agree were good basketball decisions,
Right.
but they were good family decisions. When I left and I transitioned from a pretty good situation I was in, I left because the schedule was different, and I was
Right.
able to be with my son every day, and I wasn't coming home at 7, 8, and 9 o'clock late every night and not seeing my child. You know what I'm saying, and not spending any time with my wife. So um, that's one of those things that trying to get that message across, and how important it is to the longevity, and staying fresh at what we do,
Right.
over time. So, but I appreciate you saying that. So I guess one of the things too is that, what are some signs that coaches need to be aware of? Are there some things that, in general, that you can capture? Because, like I said, being self-aware is a big part of this. A
Right.
lot of times we're not, because, like I said, I'm born in 1980. I grew up
Mhm.
around a lot of old school people, and like I said, you're able to have family members, stuff you see. We just keep going. Oh
Right.
man, come on, come on, stop being a punk. Keep on, keep going. That's how
Right.
we was raised.
Right.
But now, as I'm a father now, and you know, I handle my son a little differently.
Mhm.
Um, Now I still have my moments where I want to go back, you know,
Right. Right.
but
Right.
but ultimately, what are some general things, if we had about 2 or 3 things that you can say, hey coach, if you feel this or see this or experience this,
Hmm.
you might want to take a break. You might want to, chill out, whatever, get some therapy, get some help. Help us out with that a little bit. Take a little time on that.
Um, so it's one that comes to mind as soon as you say it, and it's irritability. Um, a lot of times, when people are tired or they hungry or like exhausted, there's different things that's like it typically wouldn't trigger you, but now it's an instant like what you said, like you find yourself getting out of character, and it's more so a result of that fatigue, that tiredness, that burnout. And I think just knowing yourself and being kind of conscious, like if you look at your calendar, you didn't work every day for the past month, what I'm saying, 2 months, and not literally working, but it could be practice, it could be games, it could be meetings, it could be teaching, because most coaches have dual function.
Yeah,
If you're at school Monday through Friday, on the weekends you're practicing, you're picking up kids, you're transporting, you wear so many hats, and a lot of times you are not paying attention to yourself, and then when you do, it's typically at the result of another, and that's displaced emotion, things like that. Or at home you're not as you're not contributing as much as you used to. You just fatigued.
present.
Any downtime you get, you're exhausted, and so just paying attention to those things. Also, just taking feedback from other people around you, like for people that are married or whatever. If your wife is, or if your spouse is giving you any form of feedback, it's important to be conscious of that. Or your children, how people are receiving you, who are closest to you. Like I said, a lot of times, from a coach's perspective, we do just keep going,
Yeah,
and it typically takes somebody to say, hey man, hey just hey whatever, you're not going to recharge, you're not going to get that rest in which you need. So I just say, be conscious of irritability, be conscious of fatigue, and just be conscious like of your health, the state of your health. So like if blood pressure is a problem, or you find new medical conditions arising, like be sure to give yourself that proper recharge and recovery time, because coaches advocate that for their athletes. There's a
yeah,
healthy way to do everything, and so
yes.
I would say keep those things at the forefront.
I like that. That's real good. Now, will do you think that at the clinic, um, do you be able to present like some strategies or present like a tool or something that we can have a takeaway with us, in
Definitely.
order to help us with that?
Definitely. And I would just say stress management as well as mindfulness are two really good health practices. So even if you just kind of like take 2 minutes, what I'm saying, to decompress in between drills yourself, or kind of give yourself some quiet time prior to going into practice or a game, kind of quiet your mind, level yourself. For even like blood pressure, just staying conscious of how you're feeling as well. You know what I'm saying?
Hmm. Hmm.
Having those things incorporated into your own self-assessment. So it's easy to look at your athlete and say, hey, you're not performing like yourself. But it's not always so easy to look at you and say, hey, you're not as peppy as you typically are. Like you dragging
Yeah,
today, da 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 da. Because of
yeah.
that, keep going, keep pushing mentality. Like people are watching you and you don't want to let them down, but at the same time, you shouldn't let you down either.
Right. It's just crazy because out of one of the chapters in my book, we have on here recognizing signs of stress and burnout, and we have practical self care strategies. All of those things are available right there. And so I got to do my plug, and that's my show. So,
Yeah.
but yeah, and I think the experiences that I've had in the last 2 decades, you know, for me to sit down and be positioned to recognize this was a need, I'm definitely stepping out into uncharted waters.
Hmm.
Um, so this is something that's new. Now, mind you, anytime somebody come out with something, somebody try to take it and run, but that's fine. I don't care about that. Um, but it is something that I'm looking, most forward to this session and having a chance to have these open conversations and try to, even that day, if there's
Hmm.
somebody that we can help, that one
Right.
person, to
Right.
get that takeaway, man. I'm looking forward to having an opportunity for you to minister to that need. So
Right.
as we continue to move on, so we have another thing. If you already kind of touched on this when it comes down to the importance of coaches to model healthy mental health practices for our athletes, one of the things that I like to do is it's just being honest when it
Right.
comes down to how I'm feeling.
Right.
And when it comes down to rest or spending time with your family, one of the things I would do with my guys, especially I go back to, I guess say my glory days at Fair Park. I only had like 8, 9 guys. Like we didn't
Right.
have a lot of players, but we won a lot of games, and so I would reward them. We'll
Right.
come in the next day off a hard fought game. Come in and we'll do some shooting, do a little some light conditioning, nothing physical, and I'll tell them, hey guys, today go home, go rest, go spend time with your family. And one of the things I did, the reason why I did that is because I come when you work in some situations as a teacher and coach. You have kids that have non-traditional families.
Right.
Mother, father, they come from different dynamics. I don't like to say broken homes because that's just not. I don't think that's the correct way to look at that. I just say non-traditional families.
Mm-hmm.
And but I always would emphasize: go home, tell your family you love them, spend time, watch a little TV with your family. Take,
Right.
relax, stay off your feet. Now, mind you, they go home and do what they want to do,
Right.
but I'll tell them I'm going home to see my son. I'm going to go play with my son. Me and my wife, we going to dinner tonight. Like I would throw those things out there, and what's happened here now, I'm like I said, I'm 2 decades in. I have boys who come from non-traditional families who are now married and
Right.
they have families. You see what I'm saying? And I have to believe that there were things that I said and modeled to help them even desire to want to lead a family. And
Right.
so, so that's one of the things I'm an advocate for as a coach is wanting young men that I coach to want to lead a family. So I guess the next thing for me would be is with asking you, what advice, and I'm going to read this, what advice do you have for coaches who may be dealing with athletes that face mental health challenges? How can you advise a coach, even if it's seeing the signs,
Mm-hmm.
uh, and how do you deal with it when you know you have athletes that have some mental health challenges?
Okay, so the word mental health and people's understanding of the word. So when we're speaking on mental health, are we talking about anxiety? Are we talking about depression? Are we talking about diagnosis? And
Okay.
so I think that makes the difference in like if a coach is assessing a player, he might say, he different, like he got some mental health problems.
Okay.
And truly, he may not have mental health problems. He may be just a different type of child or a different type of
Yeah.
player or not your norm. Um, a lot of a lot of campuses have counselors or advisors. If something is truly wrong or critically wrong, that you're like, hey, I think he might be manic, or I think he might be down or depressed, or I heard him express suicidal thoughts, homicidal thoughts, things to that degree. I think if a coach feels like something is going on with a student or a student athlete, I think it's important to, of course, ask the initial question, hey, what's going on? And as they unpack those situations and, get a deeper understanding, then I think it's appropriate to channel the next level of intervention. So, like I said, if it's just like, because then like high school is like sometimes I'm dealing with young guys and they're like, I'm like, what's going on with you? You're physically here, but you're not mentally present. And then it's like, when me and my girlfriend broke up, it's something kind of, I'm gonna say surface that we could just talk through. But if I have a student who's expressing suicidal ideation or something, then I know it's important to make sure that student is properly advocated for as well. So I do
Mhm.
think it's very important to check on the awareness of your team and of your athletes because everybody is showing up, but everybody has something internally different in which they're experiencing.
Yeah.
So I think check-ins, team check-ins are healthy. Team conversations, making yourself an advocate for student wellness
Yeah.
is big. So having a coach who cares about you, not just from a performance aspect, but a person aspect, just realizing, hey, we're all human. You know what I'm saying? So if you need anything, come to me, and kind of positioning themselves in a place to where, yeah, I'm your coach, but I could also be a companion to a degree. Like, let me know what's going on, a
Right.
confidant, you know?
Right.
And it makes a difference. And so I think, of course, the modeling by example, but also teaching, your players it's okay to be vulnerable to a degree, and trusting,
Yeah.
that your coach has your best interest in mind too.
Man, I tell you what, that is it's because we coaches, we do talk. You
Mm-hmm.
know, we all have our circle of guys that we communicate with. And, you know, depending on who you're talking to, like you said, it comes out in different ways. Like we're all saying the same thing, but it
Mm-hmm.
comes out in different ways based on our experience, based on what we've seen, what we think we've heard. And, one of the things now for me, when it comes down to when I communicate with my guys and I talk to them about their future, what they want to do with their life, and those are ways I start to dig into them and start making them think.
Mm-hmm.
I have a something I call "What's Your Plan A,"
Mm-hmm.
and the reason why I came up with this is because I'm a person. I don't like when people say you need something to fall back on when you're an athlete
Right.
because you're making it seem as if everybody's gonna make it in sports. That's
Right.
not true.
No.
So for me, it's the other way around. I ask them, who are you without this game? How do
Right.
you see yourself making money, if you finish playing in high school, college, or pro? So I don't tell them you're not going to go to one or the other. I just say, when you're done, how are you going to spend the rest of your life making your money?
Right.
What do you see yourself getting up every single day saying, I love this, and it's not treacherous and it's
Right.
not miserable? And so it's a different train of thought. And what happens is that opens up a door conversation that they've never had before. And so when I coach
Right.
them, I'm not coaching them the game. I'm coaching to what it is that they're leaning towards, the character it takes to accomplish your goals outside of sports. So
Right.
it's a different frame of mind, and it's tough sometimes. It's been tough for some guys to play for me because, like I said, I'm coaching character and not just the game.
Right.
And with that, what that means is that I'm looking at, if we spend hours working on an assignment and you
Mm-hmm.
still decide that you're going to do something different, I say you either rebellious or you're afraid. Which one is it? And what happens is it calls them to think differently about their mindset,
Right.
about how they see, like, man, I don't want to tell coach I'm scared, but I don't want to tell him I'm a rebel either. But we wind up getting a conclusion because we've had conversations where I know what's going on. These parents don't know. We know, coaches know
Right.
a whole lot more
Right.
than what some parents would like for them to know. But this is my approach, and I'm trying to share this approach with the world. With being able to communicate, because everything is not, like I said. You say mental health, is so many different things there. But if I'm
Right.
able to find out who they are without the sport, I get a chance to know them a little better, and our conversations can be a little different, and
Right.
I can handle them accordingly. You know what I'm saying?
Right.
Because if I got a kid who don't know what they want to do with their life, that kid usually struggles. But the
Right.
one who has two or three things that they're interested in, they tend to find themselves to be more comfortable in the environment with me because they know that it's not just this game I'm coaching.
Right.
I'm trying to help them be prepared for where they're going with their life. That makes sense.
Right. It does. And just to piggyback off what you said, a lot of times when I get with players, I'm like, so who are you? And then they're like, oh, I'm a football player and I'm this and I'm that. And I'm like, no, that's what you do. Who are you? And a lot of times I realize a lot of people struggle with that question, not
Mhm.
being, if I'm like on the spot, give me three strengths, give me three weaknesses. It's almost like they can't identify with who they are, just what they do. And so once you take a player and you help them develop mentally, emotionally, spiritually, even, they begin to develop a different perspective as well. And so, as you mentioned, building that character component, athletics playing sports, it puts you in a position to have a lot of transferable skills. So that routine, that
Mhm.
waking up early in the morning, that grind, that grit, if you were to put that into, let's just say, real estate or nursing, like if you put that same ambition in a different career path when it didn't, when your career came to an end, if you were essentially transferring all of those skills and going headstrong and showing up on time and being polished and contributing, you would excel in any field. But you have to
Mhm.
look at it with that same drive and ambition. And so a lot of times just giving the athletes the opportunity to speak on their strengths, identify areas in which they feel like they do well in. You good
Yeah,
at math, you good at science, like us helping them identify those subjects and roles in which they feel like they would do well. A lot of times they do if they discover that. So
I like that. I like that. Because ultimately, like you said, everything that we're doing with this conversation and with the upcoming clinic, the bottom line is, and I have to say, I got to say it for context, just the way it is. People in general don't care about us coaches, but they do care about the children.
right.
And for us, that's why it's important to make this intentional.
Mm-hmm.
Um, Taking the time out to make sure that we're good. Like a self awareness, man. That's almost non-existent. You know, really being aware. We try to promote ourselves with what we do, but really being self aware about your triggers. Um, the things that you respond to. I mean, like you got to think. Well, let's be honest here. Like I got gray hair, I got some bags under my eyes. That's stress. You know what I'm saying? That's overthinking things. Up all night looking at film. Up and down the road, worried about a kid. It's so many different things that go on, and that's why for me, with wearing the hat as a school teacher and a coach, man, it's tough. It's tough, and if people really think about it, we're high school coaches. We're not paid. We don't have a salary for coaching. We get a stipend for coaching, but we're hired and fired based on that small stipend. Like
Right.
teaching is not what stresses out. It's coaching, and and it's so what you're bringing to the table, to the clinic, and the things that we're trying to you know to to emphasize here. I think that's why it's even more important that we realize that, man, it's our job. Yes, we love our children, but it's our job. What is your job for? Your job is to take care of your family.
Mm-hmm.
And if I'm not in a good headspace, and my children, my wife or husband, my spouse is not getting the best of me, when those children graduate and go on with their life, I still got to go home to my family, hopefully, because there are coaches who have, gone through divorces, coaches who have died early, because of different things, they're hard and stress, things like that. And so, what do you think is the biggest misconception in the coaching world when it comes down to us taking care of ourselves so that we can be our best selves on our jobs and for our family? What's the biggest misconception you think that we're missing?
Um, I would just see the biggest misconception is coaches aren't they just aren't taking care of themselves. Like it's no opportunity or space created for that. So I
Mhm.
feel like productivity is pushed heavily, like you said, in spite of compensation. People
Mhm.
want to maintain their title, they want to maintain those good stats. And so as a result of that, coaches struggle. So I feel
Mhm.
the biggest misconception is coaches are paid, and compensated properly
Mhm.
for the contributions in which they're making. And I feel
Mhm.
like they aren't afforded proper rest time and recovery time. Like it's just not there. So when
Yeah.
people look at the title, they think, oh, this the head person in charge, this the whatever, and they think the title comes with the appropriate maintenance and
Yeah.
salary, and I just don't think that's the truth,
Yeah.
by a long shot. So
Yeah.
I know a lot of coaches, ADs, different things like that, and I think, like, of course, the title is nice, the flyers, all the different things that come out. But when you step outside of the role, it's so much more than the job description, says. So
Yeah,
I would definitely have to say that. And then,
absolutely.
Coach, I want to add something.
Okay.
I a struggle that I see with talking to coaches, they're just doing assessments. A lot of coaches struggle with delegation as well.
Ah,
So that's been a big one that, throughout conversation, it's like, if I don't know if it's like a trust thing, but it's more so like, if I want it done, I'm gonna do it to make sure it gets
yes,
done. And so
yes,
that in turn, that in itself, you wearing two, three, four hats, you're one person.
yeah.
And so that's something I want to unpack during the clinic as well. Just understanding, that level of trust, cohesion, camaraderie amongst your staff and your team,
Mhm.
because it's essential for the performance of the coach as well as the team. So
That I'm glad that you were able in your time, the questions that you were asking and seeing, that you were able to find something that to hone in on that. Because you're absolutely correct. Um, Finding good help is difficult because a lot, and I have to say it because you brought it up, but a lot of guys, or I say girls, or whoever in coaching, they want the game on
mhm.
Tuesday night, but they don't want the work
Yeah,
during the day. And so what happens is you have people that they want to put on the shirt and tie and the polo and get out there and show everybody, oh, I know how to coach the game.
hmm,
You really don't coach games. You coach in practice.
right,
And and with that, two of my ebooks that I wrote, one is called Strengthening Your Coaching Staff, and the other one is called The Coaching Alliance Between the Head and Assistant Coach.
hmm,
And one of those things is first establishing what your philosophy is and how you want it articulated.
right,
And then the other part is having an outline, like a standard operating procedures manual, which I do have. Those are things that I'm just letting you know. Those are the things that over time that coaches, we don't get taught how to coach. That's not what we get. We don't get um, planning, organization, structure, foundation. We don't get that. When you get a coaching job, you winging it. You
right,
wing it. And then you hope to find a mentor. And you have to actively, like one of my books is a desire to have a mentor. Like you got to have a desire to have somebody that can teach you those things to help that stuff be smoother. But
right,
and you hit it on the head, man. Delegation is tough. It's
mhm,
hard to find good, sincere, genuine help to make things go smoothly. So when you find that person, you better hang on to them because that's
right,
I'm gonna tell you, Dr. Jessica, that's hard for us coaches. It
yeah,
is. Yeah, it is. I'm glad you brought that up. But so we're getting close to wrapping up here, and I'm really enjoying learning, especially from a young, fresh mind. You're still fresh, you're young. I'm on the other side. I'm an old head. But I'm enjoying this because I can see the benefit that the partnership that we can have here moving forward is going to be in this community specific. Because ultimately, yes, I want to help coaches, but we want to help children.
right,
And I think the more we help ourselves learn more about ourselves and the signs and the symptoms of stress and overwork and all those things, I think we can help more young people because you know this yourself. A lot of young people, drugs, alcohol,
yeah,
different, popping pills, doing these different things just because they don't know how to cope. And so
right,
I think coaches, we need to model how we cope with just life in general. You know what I'm saying?
right. I
Mm.
agree.
Yeah, that's pretty cool. I appreciate that. So now I want to make sure I got this correct. So you are a psychiatric mental health nurse.
I am
You
a
still,
psychiatric.
you still do that?
I am a psychiatric nurse practitioner.
Nurse practitioner now.
Yes,
Okay.
sir.
So
Um,
now you have worked with veterans though.
yes, sir. Um,
Okay.
I work for the VA
Okay.
as a psych nurse, and then
Okay.
also now I've been promoted to nurse practitioner. So
Yeah. Take it back to the 80s, the 90s, Arsenio Hall. Ooh, ooh, ooh. I love it. I love
yeah,
it. So working in that environment and having the opportunity to talk to and screen some coaches, have you found any parallels? Have there been some things that you've been able to see? And I know some things you probably sworn to secrecy, can't say anything, but are there things that you can share that you say I've seen this consistent with what I work with now at the VA, and then with some of the conversations you had with coaches in this area?
I could say probably through transition and compartmentalizing, it leads
Mm,
to a lot of trauma. So, of course, a lot of veterans, you know, they experience combat, they experience different traumas while in the military. And, you know, they keep those things internal, and how they process them once they get out of the military has a lot to do with how well you know, they transition back into civilian life. And I would say with coaching or being former athletes, a lot of coaches, you know, they might have didn't have the best transition coming out of their sport, whether that be injury, whether that
right.
be them just not making it to that next level and feeling like they should. So I feel like how coping with that, and I feel like coping and just how they are able to articulate and express that to other people. Like I see the pain in that. So talking to coaches and like them ending that journey, and you know, a lot of times they didn't want to. Well, from the military perspective, maybe they did want to, but they didn't realize how hard it would be. A lot of those guys possess leadership. They possess great strength, and they both struggle with vulnerability. So
Right.
um, I think that's some parallels that I noticed.
Okay. I heard you say compartmentalize earlier.
Mm-hmm.
That is, man. I wonder sometimes. I guess there's some good and bad with compartmentalization. I mean, like, man, I can sit here and just think about myself, how we try to, leave things in these different rooms,
Mm-hmm.
and it comes a time where it all comes into, I'll say, like the den of the house or the great room, where it's like all of that stuff, boom, it comes together, but it doesn't always, wind up being a great conversation between all those different compartments that we have. Um, what's one of the things that you can say, I guess a takeaway that we can have to help us with dealing with those different compartments, especially with us wearing so many different hats. It's like we try to keep these things separate, but it always winds up coming out, whether it's a vice, a
Mm-hmm.
bad habit, something that's unhealthy. You know, what's one of those things you think we can kind of deal with having all these different compartments going on?
I'm one of those people who firmly believe everybody needs a therapist. The therapist needs a therapist. Everybody needs someone to talk to. And like I say, I keep hitting in on that vulnerability and expressive component, because I'm a person who believes that if you don't handle your past, it'll become a part of your present.
Okay.
And a lot of times, just compartmentalizing things and putting band aids over it. You know, if you have an open wound and you just put a band aid on it, it's only so long until it bleeds out.
Yeah.
You just have to handle things appropriately. One, to make sure they're dealt with, but so it won't be a reoccurring issue
Right.
for you. And so I just think, honestly, processing things in appropriate timing, kind of giving yourself grace. Like nothing's gonna be perfect, but addressing something head on if you can, or taking, you know, an appropriate amount of time and then talking about it, coping with it, being more solution driven.
Mm,
Because like I said, if you don't and you just keep going, that's one problem, and then something else happens, you know, that's two problems, and you just keep sweeping everything under the rug. Like you said, pretty soon that will become a train wreck, and that's not what you want. So
yeah.
find a confidant, somebody you can talk to, be expressive with, be solution driven, and give yourself grace. You know, we all trial and error here. So
Yeah, I like that. Now you cussed us out when you say vulnerability. Now it just
I
you
mean,
don't say
I know,
you don't
but
say
that's
you don't
that's
say
how.
vulnerability to coaches. That's a cuss word. Like you
Hey,
what vulnerability?
hey, that's where we
Yeah,
start. That's where we start with
yeah.
our honesty and self
I'm
assessment.
cool with it. I'm cool with it, but it's that's definitely something that's tough. I had to learn. I'm so willing to be open and transparent. I had to kind of temper myself with meeting people, because I don't mind. Like it's just I don't know. I'm
But
kind
you
of
had to get there. You had to get there. You weren't always that way. I know.
honestly. I'm telling you, I've always been a person that people could talk to. I
Okay.
remember in high school, like I can remember just I would get people's business. I'm like, why is y'all talking to me? But it was like, but I had a way of listening
Mm-hmm.
without judgment. And then somewhere along the line, I lost that. For some reason, I got real judgmental. I don't know what happened to me. and then when- and, and then when I
Okay.
came and then when I came back to myself, like, dude, you're a human being too, and you got a lot of screw ups. Then they helped me to go on settle myself down. So, but yeah, that is something. I hope that we can dig into that a little bit
Okay.
to the clinic, or we can dig into that a little bit more. When we get there, and I would love for you to dive in that. But I'm gonna tell you something, Doctor Jessica Davis. This has been so much fun and informative. And like I said, I really appreciate first off the first time you called. Like that was groundbreaking. The timing on that was perfect. It was perfect, and definitely looking forward to the future. With getting a chance to partner with you and what you do and what you bring to the table. But right now, we're pushing the clinic. March 29th from 9 to 3. Y'all make sure, as we're closing out here, y'all make sure y'all go and register, man. We're excited about what we're bringing to the table here to the Shreveport Bossier area and surrounding areas. So make sure you register. Everything's right there at the bottom, edgehamilton.com. Um, /clinic registration and get your spot, and you'll get a copy of my book and workbook. Also, we get some goodies, we get some breakfast and lunch, and get a chance to network and hang out. And we are looking forward to having you all there, and you get a chance to see Dr. Jessica Davis along with our panel, and we're going to have us some fun. So, until the next time, this is Coach Hamilton from the Coaches Code. We appreciate you. Y'all get some rest.